Hi listeners. I will be talking on inequity in healthcare delivery Malaysia. One of the problems of inequity in healthcare delivery in Malaysia is consumer demands for new medicine and healthcare facilities. The health system has some control over the supply for health services but not much on the demand for healthcare services. Consequences include inequity in access to health services, inappropriate interventions and treatments as demanded by patients or induced by providers, varying quality and standards of care and costs that cannot always be effectively controlled. Malaysia, in realizing these problems, has taken steps to correct them. Interrelated shortcomings need to simultaneously be addressed too. Among the shortcomings are inadequate information on service mix, costs, and evidence especially from private sector to diagnose the problems. Some solutions were unable to have desired and sustainable impact as they failed to adequately address the root causes, and political considerations make these efforts difficult. Quality of care suffers from delays in the introduction of new treatments. Specialists are too often overworked to participate easily in clinical trials or to investigate new therapies. And because the country has few controls over hospitals, it has inadequate mechanism requiring them to adopt improvements in care. Furthermore, the sections responsible for approving effective new drugs and devices is understaffed, which may delay the introduction or wide adoption of some new treatments for several years even after they are approved and adopted. Rising healthcare costs is inevitable. Demographic changes and changes in disease pattern and lifestyle would influence healthcare costs. The introduction of new technologies and ever-increasing consumer expectation for high-cost quality care are factors contributing to rising healthcare costs. Demands for new expensive medications such as antihypertensive drugs and new types of high-cost services such as transplants and implants and ICT-based services will have a significant impact on the limited health resources available. Healthcare facilities and services delivery gaps continue to exist despite increased expenditure on healthcare from 16.8 billion Malaysian ringgit in 2011 to 23.3 billion Malaysian ringgit in 2015 by the Ministry of Health. The public healthcare facilities and services in urban areas are still inadequate to meet the health needs of the population, particularly the poor and low-income households. Lack of connectivity and low frequency of mobile healthcare services as well as inadequate facilities hamper efforts to deliver quality services to population in rural and remote areas. Thank you.